All right, team. Welcome to Plastic Surgery Untold, the greatest podcast in the world, as voted by us. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon. We have our celebrity cast back again. Despite our best efforts to replace them, they're still here. And then we have a special guest, Dr. Sarah Saxon, and we'll get to her in just a minute. As today we're talking about facial feminization by the Saxy Squad. And but before we get into the greatness of this unique surgery, let's catch up what everybody's been doing. Berto, anything new on the most beautiful man's home front?
Not.
And you're looking beautiful for today. For those that are just listening and not actually watching, which they should be on YouTube.
Thank you.
Or Instagram.
I'm trying to I'm trying to get into like the festive seasonal mood here with my.
But you don't really have green on or anything.
No, it is green.
Oh, it is.
Yeah, it's green with a little red pocket square.
Oh, we're gonna have to talk to the studio. You look blue. As you can tell, we're not in the same room.
Yeah.
Trying to be
We're
trying to be COVID safe here, so we've got a little bit of a distance going. So okay, cool. Well, what else is going on besides your festive season?
Just had a good little visit with the family for the holidays, Thanksgiving. My parents came in to visit, and we did a little Thanksgiving lunch. If you may recall, you were an invited guest.
Oh, I was. My Winston pooped on your rug.
He did.
Oh man,
He christened my place.
He did.
Oh, no.
And
better him than John.
Celebrity. What about you? What's going on in your life?
Oh man, we have been moving for the past 2 weeks into the new place. So the new place is finally finished, and it's been awesome. We crossed the finish line with that, closed on the old house and the sale, and now we've been moving in, which has been a nightmare. Warning to anybody who's going to move or in the process of moving: take at least a day or two off work. Just do not do it while you're working full time. That's it's not very easy.
But so you're in the new house. You're living it. You've already,
In the new house, we've been there now for like 4 or 5 days, and it's been great so far. We really like
That's awesome. Congratulations.
Everything you thought
you.
it'd be,
and more.
Damn, that's awesome. Speaking of moving in, we're down the home stretch to finally move into our new office. I know I've been talking about this for 2 years, but we got 2 inspections left, Monday and Tuesday, and so hopefully, fingers crossed, all that goes well. I was actually gluing numbers on the door this morning in the rain, so if anyone saw me, working hard,
That's so exciting.
Sarah, tell us a little about you. I appreciate you coming to join us today, but tell the world a little bit about you and your practice and what you do.
Yeah, so I'm Dr. Sarah Saxon. So I am a double board certified facial plastic surgeon.
What does that mean?
That means that facial plastic surgery is a subspecialty of ear, nose, and throat surgery. So I started out in a residency of ENT. So I have a board certification in otolaryngology. And then my fellowship training's in facial plastic surgery. So we have a separate board for that. So I got to take 2 tests.
Double the fun.
Right.
And just for people listening, facial plastic surgery typically refers to what type of procedures? I know it's easy for you and me, but maybe not for everybody listening.
Yeah, anything from the neck up. So, of course, it doesn't include brain or spine, but besides that, I can basically do anything. So, typically facelifts, rhinoplasty, cheek augmentation, chin augmentation, craniofacial surgery. Also involves reconstructive surgeries. I used to do facial trauma in a former life when I was up in Dallas in academia.
I feel like rhinoplasty is a big one for facial plastic surgeons who had a full ENT training, because kind of gets you a little bit of the best of both worlds from a functional standpoint, kind of from start to finish. I know in my practice, I don't do nearly the noses you do, but I don't really do much of the functional. And so a lot of times I'll incorporate someone like yourself or an ENT to help if they do a functional portion while I do the aesthetics. And probably one of the unique cool things about your training is you can really combine all of those things together.
Correct. Yeah. And some people still decide to do some ENT in their practice. I chose not to. So I'm full-time 100% facial cosmetic surgery now. Like I mentioned before, I used to do some reconstructive surgery when I was up in Dallas at UT Southwestern. After about 2 years, I decided to leave my practice there and set up my own shop in Austin and be my own boss. So that's nice. We are actually just getting ready to open our second location back up in Dallas.
That's congratulations.
That's finally happening. It's been a long time coming. So I'm actually going tomorrow just to set up the final punch list to see what else we got to get going. So
awesome.
Probably February, I think, is our first clinic.
That'll be exciting.
Space up there.
That's fantastic.
I don't want to get off tangent because it's not the topic for today, but we've talked in the past about the importance of having somebody who is properly trained to do your procedure. And I don't want to get us off tangent, but and if Gilberto or Travis has some stuff right in, but I think the thing that's important from what you do to somebody who isn't trained in, because we've had a lot of plastic surgeons on here on the show. Correct me if I'm wrong, but I think Sarah's our first facial plastic surgeon.
She is, yeah.
Awesome.
And so the cool thing about this is you went through a AMA accredited surgical residency, and then there's a formal fellowship that towards the facial plastic surgery. So
Correct.
It wasn't like you just did some stuff and then said, hey, took a weekend course and then
Right.
decided to do this. And
Yeah.
I think that's the point I'm trying to get across to people about the long road that you
Yeah.
took to get to this spot.
Yeah, and actually, facial plastic surgery is pretty intense to be board certified. You have to wait at least 2 years after the end of your fellowship and accrue a certain number of cases, take an oral and a written board. So even I would say it was probably the hardest board that I've ever taken, hardest exam, because I think it's so scrutinized and a lot of people get confused about it. So I think the facial plastic board wants to take that extra step and make sure that they're limiting the number of people. So you don't see a lot of facial plastic surgeons depending on what part of the country you're in. In Dallas, there are quite a few just because there are a lot of surgeons doing cosmetic surgery in general. In Austin, there's only a handful of us. There aren't that many. So
Okay.
just depends.
Well, we're lucky to have you.
Yeah.
And I didn't want to belabor the point, but I think it's super important because I think some of the certifications and different board stuff, I think sometimes can be very confusing to
Right.
people,
Mm-hmm.
especially when you're having something very specialized done.
Yeah.
And that rolls
Absolutely.
into my next point, which I do think that Austin's very lucky in that we have, for the size that Austin is, I feel like the unique, and Travis, you deal with more range of people than I do, but correct me if I'm wrong, but Austin has a super unique amount of sub specialists because
Yeah.
plastic surgery itself is a subspecialty, ENT is a subspecialty, facial plastics is a subspecialty inside of subspecialty, and then you do facial feminization, which I would consider a subspecialist,
Yeah.
even inside of all of that, and which
Right.
to me means that people have had some additional training in some of these things, because a lot of these very unique endeavors, not everybody does. And Austin's so unique, and not just facial feminization, but microsurgery, other things. There's just a very unique collection, and we're lucky to have
Yeah.
you here as someone who specialized in this. And you have people from all over the country that come to see you here in Austin.
Correct. Yeah. And I think Austin is a great city for it. We're a very creative city and tech savvy city.
Yeah.
So I think it attracts a lot of great minds and great thinkers in medicine to sort of rock the boat and change how we do things. And
Plus, it's not a bad place to live. I think
I know.
getting
It
people
is.
to come out here
Yeah.
and set up shop is not a hard sell.
yeah.
For those people who aren't familiar, can you give us kind of the broad Wikipedia version of what facial feminization is, and we'll dive into some of the most common
Yeah, sure.
procedures that includes?
Yeah. Well, I think to start, it's important to know what is the difference between a masculine and a feminine face. So one big difference is in the upper face. So we want to make sure someone has really large eyes that pop. So typically we want to enlarge the eye sockets, basically lower the hairline and raise the brows. And even filling in the cheeks bounces light up into the eyes. So a feminine face really emphasizes the upper face rather than the lower face. And for that reason, also thinning out and slimming down the lower face also distinguishes a feminine face from a masculine face. And of course, the same goes for looking young. Also helps someone look feminine as well.
So, but just so our listeners don't get confused, when we're talking about, because you do a wide range and you do facelifts on men, women, anybody. You do a lot of rhinoplasties. I know you do
Correct.
revision rhinoplasties, but when we're talking about facial feminization, does that include just someone who feels like maybe they need to look more feminine? Is this more people who've undergone some type of gender reassignment surgery, or is there kind of a spectrum?
There's a spectrum. And
Okay.
actually, the procedures that I do were popularized by the transgender community, and it's particularly for someone transitioning from male to female.
Okay.
But I do the same procedures in everyone. I have men come to me for brow bone reduction. I have women wanting to look more feminine because they have masculine features. And every woman, as they get older, they sort of develop some masculine features, like their brows get lower. You know, as the skin starts to sag, it makes their jawline look a little bit wider. So I kind of think of everything I do a little bit as facial feminization.
And do people typically know exactly what they want when they come to see you, or do people typically just come in and say, hey, I want to soften my look, I want to feminize my look a little bit, and then do you help guide them? How does that process start and roll? Because it seems like such a broad topic and so many things you could do.
It really depends on the person coming in.
Mm-hmm.
A lot of people have been researching for a long time online, and there are huge collaborations of people, and a lot of my patients have friends that had the same procedures. So a lot of people come in having an idea of what they for sure want, but they usually are open to me making other suggestions as well. There are typically some people that come in and say, I don't know what I need. I just want to look good. I want to pass as female full time.
Oh, so you've had G. Berto in your office. He just wants to look good. Okay, cool. Yeah, none of that makes sense.
Yeah,
I brought her some wish pics.
It's a full range. So
a celebrity should be honored that you brought his picture in, you know?
Yeah. And now that morphing software is so mainstream now, a lot of people will come in with already a face-tuned photo of themselves saying, this is what I want.
Do you do that type of software imaging in your office?
I don't, because I usually say, it's a different skill to morph a photo versus surgery, but I do use it as a communication tool. So I have an app called Face Touch Up on my website, and I'll have people upload their photos and kind of morph it themselves. And if they want to bring that into the office and say, hey, is this reasonable? I'll say, yeah, that's good, or no, that's impossible to do.
I was interested in your statements about this, because even with our body contouring, I think with the, and correct me if I'm wrong, but I feel like with just pure noses, like a non-revision stuff, I think with breast dogs, some of those visualizations are really, really good.
Mm-hmm.
When you start looking at other features where you're needing skin to retract, I think with lipo stuff, like there's so many factors into account.
Right. It's not really realistic to have
some of those things are hard to predict for a
Right.
computer. They can't tell if you got stretch marks, if you got like
Right.
loose platism. It's just
Mhm.
the list is endless. You know,
Yeah.
big salivary glands.
Right. So it's good for rhinoplasty and chin augmentation, but besides that, morphed images are a little bit more difficult.
But I agree with you. At least an idea of, we do wish pictures for the breast and butt that I do all the time, and it just gives me a general idea of what people are hoping. Because
Mhm.
sometimes, and it sounds like you do it too, where you have to just have a frank talk and say, I can't do that.
Yeah.
And kind of then make sure that we're upfront. And I tell people, I'd rather they be disappointed at that consultation than, $15,000 later. And especially your face, that's not something that you can necessarily hide. And we'll get into recovery in a little bit,
Mhm.
because there has to be some bruising, swelling that's involved with most of the stuff you do.
Right. And I think probably the one procedure that is probably most unrealistic with those images is the jawline, because a lot of times photoshopping or even Snapchat filters, they'll give a super sharp jawline.
I
that's
love me
super
some
narrow.
Snapchat filters.
I
I love
know.
me some. Damn.
Actually,
Damn.
most Snapchat filters feminize the face.
Really?
So they'll do some of the same procedures that I do,
That's interesting.
but on an exaggerated scale. So I have to rein people in and be like, that's not really realistic.
We can't do that.
What would be the top 4 or 5 procedures in facial feminization, just to make this real for our listeners who are thinking like, maybe that's something I'm interested in, but what are the most common?
Yeah, so the most common is what I call the forehead package. So I trained with Jeffrey Spiegel in Boston, and he
Mhm.
did a lot of the research behind what makes a feminine face the most feminine, and he found out that the upper third of the face really makes that determination more so than the other parts of the face. So
Was this pre or post masks and COVID?
pre
I'm just putting this in context, okay? Because you're very young. Go ahead.
I'm not as young as you think I am.
Just a lot of Botox
I
in the
drink the
face.
Kool-Aid.
A lot of Botox
I'm
in the
always
face.
poking myself. So my forehead package involves brow bone reduction, so literally setting back the brow bone,
Mhm.
lowering the hairline, and raising the brows. So that's what's gonna really make that eyes pop the most. The brow bone reduction is not as easy as you would think. On the sides, you can shave down the bone.
And it's funny, I was thinking, gosh, that brow bone reduction has to be so easy. I was like, damn, if I do this in my garage, fuck.
Well, a lot of that is probably the surgery that needs the most revisions, because there are plenty of surgeons out there that think you can just shave it down and be done.
No.
I know. And so in the middle of your forehead here, you have the frontal sinus, which is a pocket of air surrounded by bone. So you can't just shave that down. You'll be either left with some eggshell, really thin bone, or a big hole in your head. So we don't want either of those.
No, I don't.
So I basically take that bone and set it back and use some titanium plates and screws and have it be kind of flat. You want a smooth transition from your forehead to your nose.
Okay.
So that's one. I would say the next would be V-line surgery or jaw contouring. You can do that with either just shaping the bone with a special contouring tip that I have, or making cuts in the bone. Sometimes you can...
I feel like jawline is something that has taken off kind of across the board, because we've talked about it on this show before.
Yeah.
Just from, obviously I think your stuff is a little bit more of the bigger changes, but, filler, other stuff, chin implants, stuff like that.
Yeah. Actually, V-line surgery is popularized in Korea, so then it finally made its way over here. So it's another surgery I do very often in just the everyday person that comes into my office, not necessarily just in transgender patients. So I would say a third. So you wanted 4, right?
How about tracheal shaving? I've heard of this. Is this a thing?
I was gonna say.
Is that a thing?
I hate the name trach shave, but because it's technically not the trachea, it's the thyroid cartilage. But somehow that name caught on, and that's what people know it as.
I wish we had a whiteboard so we could make G-Bert to draw this out for us. Drop a little anatomy on everybody watching YouTube right now.
Yeah.
And just show us the difference. But maybe next time, G.
Yeah,
maybe
I'll make sure to invest in one of those for you.
So trach shave, otherwise known as Adam's apple reduction. I make a tiny little incision right under the chin here, and we remove that bump. And it's a little bit easier said than done because your vocal cords live in that cartilage. So I have to use imaging and a flexible camera in surgery to make sure that the vocal cords don't get damaged.
Does
I've
anyone
seen this.
I know Travis has helped me in those cases.
But that was gonna be my question. Does celebrity actually help during this, or does he hinder you?
No,
he
no,
does. No, he does. Oh, okay.
No,
He
normally
drives the camera for me.
Yeah.
Oh, really?
Yeah.
That's
Yeah,
interesting.
I know. I actually do work sometimes at work. I was just going to say, I've done these cases with a couple different people, not just here in Austin, but also in Scottsdale. And, you definitely take your time. And what's interesting about you go the extra mile when we're doing these cases and have me put in that flexible fiber optic scope so I can see between the vocal cords, and you can see exactly what level you're at to take off that thyroid cartilage, so we don't risk damaging, there's still some small risk of damaging vocal cords, but everything we can in our power to limit those risks and reduce that.
Yeah. And if you have VULS, it's called the anterior commissure, where the vocal cord is attached to the cartilage. Yep. If you disrupt that attachment, it's almost impossible to get your voice to be normal again. It takes some pretty extensive surgery.
But can you do something to my voice now? Because I feel like I'd like it to be a little darker, a little more like, what's going on, Sarah?
A little more brooding.
Yeah, a little more masculine.
That's all speech therapy. I'll send you to somebody good.
Can we, because I'd like to take people through the process, because I think it's really unique. And I think some people listening to this may have a hard time of figuring out like where to go. Because as we talked about at the beginning, it's very, very subspecialized. And maybe we can kind of walk through the whole process in kind of a 2-minute nutshell here. But if somebody's interested in this, how do they find somebody? How do they know whether this is something that someone does routinely? Because I'll be honest, tracheal shaving and most of the stuff you're talking about is not something I do in my practice. And so how do they find a subspecialist, to someone like you who does these procedures commonly?
Yeah, it's a little bit different than most other procedures because there are so few people that do them in the world, really, that you can Google it. And really in the first 2 to 3 pages of Google, you'll find everybody that's busy doing it. So it's not something that you have to keep scrolling. However, there are a lot of people now that it's become more mainstream that are trying to sort of dabble in it. Mm-hmm. So that's what is more difficult. So you have to really see that they have a lot of before and after photos, make sure that they have other resources on. Usually the people that do this a lot will have resources to endocrinologists to get hormone therapy or a therapist in the area. Some surgeons have patients fly in from all over the world, so that won't necessarily be a localized thing, but also resources to, if and what insurance plans are taken for transgender surgery and facial feminization. That's more typical in California. Texas is more difficult. It changes from month to month, it seems like, the insurance world. But the people
You're talking about whether this would be a covered procedure
Right.
by insurance.
It used to be never, and
Okay.
now sometimes.
Okay.
But
Unfortunately, that's what I tell breast reduction patients too. Maybe. And sometimes it varies from an insurance plan to insurance plan. So,
yeah.
just because Gilberto got covered for something doesn't mean that Celebrity would, especially if they're covered by different insurance companies.
Yeah.
I needed
But
those
I-
calf implants, John.
I was going to say, I need my calves to be bigger too.
It usually depends on who the person works for. So, like,
Sure.
companies like Starbucks or Amazon or Google, sometimes their specific insurance plans will cover it. But if a surgeon really does a lot of this surgery, they'll be more knowledgeable about all the ins and outs of all these little details, and when to come off hormones, and how they'll have a specific post-op care plan, which I know we're going to talk about in a little bit. It's not just something that they may do once or twice a year. It's something you do on a weekly basis.
I'm sorry, Dr. Saxon. Are these procedures procedures that are done like in stages, or is it all done like at one time when you're doing these feminization type procedures?
It really depends. It depends on how much downtime a person has. If someone's doing a lot of surgery, sometimes these can be up to 8-hour surgeries. I mean, you really need to take a month off of work, and mostly for swelling, you don't really feel bad. The times that I say absolutely you have to stage it is if it's an older person. So they not only need all the bony restructuring, rhinoplasty, lip lift, all those types of procedures, they also need procedures that help them look young, like facelift and blepharoplasty. And those things, if you account in the one stage procedure, it just doesn't look as good. When you're doing a facelift and someone who's already had 8 hours of surgery, they're so swollen that once they heal, that skin is just going to recoil back a little bit. I just don't think that the results are as good. So I stage those patients out about 6 months at least, if not longer.
We always worry about standard stuff too. Once the surgeries get long, I mean, people start to get tired.
Right.
Two, we worry about DVT, blood clots. It's one thing if it's a big, tumor in the face and you have to do all these stages at once. That's much different than stuff that we can electively do that's not going to harm somebody.
And it's different for me because, back in my former life, I had residents and fellows and a whole team of people to help me, and now it's just me. So I actually.
Well, what about Celebrity? He's part of your team.
Yeah, I mean, scrubbed in, helping with surgery.
Not just there for moral support and keep the patient still.
It's really physically taxing on the body. I actually inject my neck with Dysport because I get, knots in my neck from these long cases. So I cut it off at 6 hours, and if it's longer than that, I'll stage it out.
I think that's just a pretty good general rule of thumb as far as I like that 6 hour time, because then at least you can have that conversation like, hey, okay, at 6 hours, what are risks going to outweigh the benefits, or the benefits going to outweigh the risks? Like, how do we make these decisions? I like that 6 hour time.
And it might go over a little bit,
Sure.
But if I'm anticipating longer than 6 hours, I'll say, hey, and some of these procedures can be done in the office too. So I do lip lifts in the office all the time. So I'll say, hey, we can do these procedures in the OR. Why don't you come back a few months later and do a lip lift and blepharoplasty in the office? And that cuts down on some of the time too. So,
and I think that's super important is where you have somebody with some experience that can help guide the order to do stuff. Because I think sometimes if you're changing jawline, bony structures, and then trying to do a facelift or something, sometimes the order doesn't matter depending on the specific situation, but sometimes it does. And you want someone to help guide you a little bit to make sure you don't kind of mess up the order and then having to revise things.
And for the most part, people stage things just from a financial reason. So I can give them kind of a stage criteria of like, this is really what's most important for you to look the most feminine. So do this first. And then here is a second surgery. We can do this second, and here's the third.
It's funny because we talk about that all the time. This is the biggest bang for your buck. This is where you should start. Boom.
Yeah.
Well,
exactly.
Helping the patients prioritize some of that stuff, because you guys see the finished product, and y'all have done cases where patients have had 4 or 5 things done, right? So y'all know, hey, for if you have this much money right now and you've got this much time off that you can devote to this one thing is going to give you this facelift is going to help the most with rejuvenating your look, and you guys can help guide them through that.
Mm-hmm.
And then, as people, so now people have found surgeons do in the facial feminization world, because it is such a subspecialty. Do you tend to do virtual appointments, at least as a first screening, to see if people even a candidate, get an idea of pricing? I know at some point you see them in the office to kind of go over some of the fine stuff, but is that an option? Because it seems like if you're out in West Texas, maybe really hard to find somebody who does this without coming to Austin or Dallas or Houston.
That was actually one of the easiest things that I went through during COVID, is we already had that infrastructure for virtual visits in place, because I do get people from all over the world, really. I did a consult the other day from someone in Singapore. But so that's something I typically do. I have block time in my clinic schedule for virtual visits. So it's something I do every week, even now that we are back in the office.
Which I think has been really nice for people, especially for sub-specialists, because, while it may be, 30, 45-minute visit for us in the office, if they're coming from something like, West Texas, Odessa, Midland, my aunt, and I picked that because my aunt just drove here because she had a heart procedure done recently. It took them 7 hours because of road construction each way.
Right.
So, that's not nothing.
Right.
And so, and to at least get an idea, get the ball rolling, and make sure this is a good fit.
Yeah. The hard part is I still have to see people for post-op visits. So you can still have wound issues. These are huge surgeries. So you still have to know, if you're traveling somewhere to have these big surgeries, that you have to be willing to go back if there's an issue with healing. And that's probably the hardest thing that people have to grasp. But if you find someone that does facial feminization in your area, they still may not be a right fit from a personality standpoint and from an aesthetic standpoint, because everybody has their own style. Yeah.
Yeah. G. Berto and I talk about that all the time, because we feel like our style is very similar, and so I don't know. We'll see what happens.
I couldn't agree more, Dr. Franco.
And then from a surgery standpoint, if you had a couple tips, words of advice from preparing for the surgeries, going through the surgery, what would you tell people in terms of these procedures?
Yeah. Well, typically, if I have someone who's trans, they're on hormones, and the hardest part of preparing for surgery is going off those hormones. And that's from a safety standpoint, because you run the risk of DVT, or deep vein thrombosis, during surgery if you're on high doses of estrogen and sitting paralyzed while you're asleep during surgery. So I always have everyone come off of hormones for 2 weeks beforehand. And then as soon as they're up and walking around after surgery, which most of the time is the day after surgery, then they can go back on them. But it's almost like experiencing menopause a little bit. So like some mood swings, some night sweats, all the good stuff. So that can typically be the hardest part.
So something they should make sure that they're clear with their physician.
Correct.
Before the surgery, if it's coming up, just to make sure they're.
And then maintaining good nutrition, because I have seen some wound issues just from not getting enough protein or vitamins in their diet. Being optimized medically, that's very important, because you want to heal well. I don't have as many wound healing issues as what I think about in body surgery. You might say otherwise, but the face has really strong blood supply. So I don't usually see infections or things like that, but it does happen from time to time.
And this is something we've talked about, in terms of pre-op clearance stuff, and getting labs, other things done ahead of time, especially if they're coming from out of town.
Right.
I tell people, do it sooner rather than later, so there's time. If you need to adjust, do something. You don't need to do them the day before, because you come all the way to Austin and you get canceled for your surgery. That's heartbreak for everybody.
Yeah. Yeah, and everything that I do is very visible. So any incision that I make, especially in the hairline or lip lifts, you want those to heal really well. I actually now started putting everyone on Mend, which is a powder supplement you can put into smoothies. So after jaw surgery too, you're all swollen, so you're using smoothies and milkshakes and everything too. So it's just really easy to put in some powder and get your vitamins in. So
just like that. And then what about recovery? What are some recovery tips that you have for people?
Yeah. The hardest part about recovery is the lower face, because gravity brings all that swelling in. You have lots of huge muscles that attach to the mandible. So that's the hardest part. And I'll have people on steroids for that. It's hard to chew, hard to talk. The other part of the procedure after forehead surgery, your eyes can sometimes swell shut. You get so swollen. Another reason I have you on steroids. But those first 24 hours are the worst. And after that, it's really not bad other than dealing with boredom and swelling, but I don't typically see a lot of pain.
Just doing a little Netflix and chill. Netflix and chill, if you will.
I do hear stories from other places where patients will be in pain, but I use a lot of regional anesthesia during the procedure.
I can attest to this.
Yeah.
I love it.
And
I love
then
it.
after surgery, I alternate Tylenol and ibuprofen every 2 hours. And so most of my patients aren't even on narcotics. They're just taking those, some icing to help with swelling, and that's about it.
Let's jump into that, a little bit of anesthesia for this, and maybe you and Celebrity can talk a little bit about any special stuff. It sounds like you do some blocks.
Mm-hmm.
It sounds like during these procedures, and maybe anything special that Celebrity does for some of these facial procedures.
Yeah, I mean, most of the cases that I've done with Dr. Saxon have been general anesthetics, and with those cases, the patients are completely asleep, completely unconscious with the breathe-in tube, especially when we're doing rhinoplasties and things where I have to protect the airway. We have to have a breathe-in tube down into the trachea to completely seal it off. So none of the stuff that we're rinsing out in the nasal passage, any blood or anything that may drip down, none of that is going to get into their lungs and down into their through their trachea into their lungs, because that can set them up for postoperative pneumonia. But other than that, pretty straightforward cases. They're incredibly challenging on her end. Lucky for me, once they're intubated and everything's set up, they're pretty smooth cases, and they're even smoother because, like she alluded to earlier, she uses a lot of regional anesthesia. So once she goes in and is able, and the patient's already asleep, she's able to localize certain nerves in the face or in the trachea in wherever she is taken care of, and she's able to completely anesthetize them. So the patient is not transmitting any of that pain to their spinal cord and to their brain. So that's not even being sensed. It makes my job a lot easier.
But you make everything look easy, Celebrity. I mean, that's just a given. That is just a given with you. Damn.
I don't know about that.
Damn. Even those jogger scrub pants, they just look so good. They just look so good.
Yeah. So
you have jogger scrub pants too?
I do.
That's
that a girl.
Interesting. Damn, if I had the ankles for it. If I only had the ankles for it.
I know what you're getting for Christmas now.
What other take homes would you like us to know, or would you like the world to know about facial feminization surgery?
I would say it's a really rewarding surgery. I think there are a lot of nuances to the face that a lot of people don't really get with your typical facelift, rhinoplasty. There are a lot of other options out there than what you're normally searching for online. So if you don't really understand exactly why you don't like something about your face, and the things that you're researching aren't really, you don't think that it's going to help you, there's probably another option out there. And usually that involves a bigger surgery like bone work, but I think it's going to make a big difference, and it's not as obvious as people think. Usually you look really, really natural. It's not like you're kind of a caricature of yourself. It's just making tiny millimeter changes that end up making a big difference overall.
Because even with a lot of the bony structure you're talking about, and just so people don't get confused, you had most of these incisions just like we do with the facelift, either right at the border of the ear, the hairline level, up in the top of the hair, and some fancy zigzag. There's lots of ways that you're hiding this. There's very few actual facial cuts, or in through the mouth and through the inside eye, like we would do like a bluff.
Right.
So you're still using all those aesthetic tricks for all this bony work. And that's what makes some of these big challenging. It's not like you have a big cut across your forehead.
Right. Correct. Yeah.
just don't want people who are listening to get confused that all this fancy stuff you're doing is coming straight through.
Yeah, she's being modest. She's very, very, very good at what she does.
It's actually, I feel like facial feminization, especially doing bone contouring, is so much more like sculpture than anything else.
Sure.
It's not something that you can, some people talk about virtual surgical planning, and I think that's useful, but you can't discount your eye when you're drilling and contouring the bone to know when to stop, because that's just going to look good.
Mm-hmm.
And it takes more of an artistic eye than just a left brain surgeon that can look at a CT scan and say this many millimeters. A lot of it takes some finesse at the time of the procedure to know when to stop and what's going to look natural.
And I feel like that's hard because it's kind of a moving target a little bit. It's not like our breast dogs where we can just sit them up, at the sizers and say, damn, that looks good.
Yeah. I think especially with jaw surgery, I've seen it overdone before.
Mm-hmm.
So some surgeons will cut off the angle of the mandible, which is fine in some people. But for others, you're kind of left with no jaw back there.
Mm-hmm.
And you don't have anything for the skin to sit on. So no matter how much you want to create a jawline, you're just never going to without adding in implants or fillers back in because they've over resected the bone. So maybe on a CT scan it looks great, but when you look at a person after they've healed, it still doesn't look
So
awesome.
Measure twice, cut once. Is that what you're saying?
Yeah.
And so we like to do a little segment on the podcast called Behind the Bovie.
Yeah.
And so this is something either in surgery or behind the scenes that you think is really cool that most people wouldn't think about in the surgery. What's a cool little nugget you can share with the world?
A cool little nugget. So about the surgeries itself, or just
anything in the world of facial feminization?
So some people don't know this. About 5% of people do not have a frontal sinus. It's just solid bone in your forehead.
Ooh.
I didn't know that.
I feel like that's Gilberto. I feel like that's
Oh,
Gilberto.
you saying I'm hard-headed?
Yes, I am. Yes, I am.
So for the most part, I have to use titanium plates and screws for forehead surgery, but there are those 5% of people that it's just solid bone, and I can shave it down because they never developed a sinus.
Damn. Okay.
Very cool.
Cool. Can we do a quote of the day?
Got a little quote of the day ready? All right.
Let's
all right.
Who's taking this?
I'm
Celebrity?
taking this one. I'm taking this
Okay.
one. This is Maya Angelou, and it says, I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. I thought that was good for the facial feminization thing because, I mean, small changes make a huge impact on these patients' lives.
Mm-hmm.
I like it.
Any comments? You seem
No,
speechless.
I feel like Travis just did a mic drop here.
Oh, really? like footprints on the moon? Okay. Well, cool. Well, before we wrap up today, I do want to, because as some people may or may not know, not exactly the day, but this puts us basically at our 1-year anniversary, because we film a couple episodes in one day. This will be our last filming for the end of the year. So 1 year. So I got all of my colleagues. I can't hand it to them because of COVID screening, and obviously why I couldn't tell that Gilberto's got a green coat on. I did get us, and I don't know if they can zoom in on this, but I got us some plastic surgery Untitled Yeti mugs,
money.
extra large here. So I got one for each of my colleagues here, and as a new tradition, one for our guests. So our guests get a Yeti mug. They got to carry around our podcast.
Awesome.
So boom, boom,
This
boom.
is so awesome.
Yeah.
Very cool.
Little something. Producer Donald, who's sitting behind me, may or may not get one. Depends, whether he carries some weight today. I don't know if they can zoom in. He's back here, just kind of hanging out. Not sure what's going on back there. It was supposed to be fact checking Gilberto, but Gilberto didn't say anything today. So, team, any last words? Anything before we wrap this up?
This was really great cast. Thank you, Dr. Saxon, for enlightening us about facial feminization.
Thanks for having me.
I truly appreciate you coming in, and nice to have someone who's such a sub specialist, take the time out of your busy schedule to come enlighten us, because this is something I don't do in my practice, and so truly appreciate it. And I think there's a lot of people out there that would love this. And tell people just again one more time your website and how they can get a hold of you if they have questions.
So my website is saxonmd.com. You can also follow us on SaxonMD on Instagram. We're on Facebook. We're everywhere on YouTube.
And you even got the Saxy Squad. What is
we
that?
We have the Saxy Squad. There's kind of a long story behind that, but since my last name is Saxon,
so we're gonna get the PG version.
So actually, when I was at UT Southwestern in Dallas, I found out when I was about to leave from there that the residents, before I would staff a case at Parkland, they would say to themselves, "It's Saxy time," and so it just kind of like caught on. So a lot of my marketing is, we have Saxy lips and Saxy cheeks and Saxy lift and everything.
But I like the Saxy Squad.
Saxy Squad is just everybody that is associated with our office who can be in our little special club.
Awesome.
Well,
we appreciate you letting us be part of your club today.
You're totally a Saxy Squad.
Saxy Squad.
I love it. It's nice to have some female energy on the show again.
I know.
Well, I'd like to thank everybody for listening. Plastic Surgery Untold. Download us on iTunes, iHeart, and now Pandora,
Boom.
wherever you get your favorite podcast. So the greatest podcast in the world is voted by us, Plastic Surgery Untold. Thanks, guys. Bye. See ya.
See ya.